those who don't want to be exposed to it. The day after the election, I met with the Ohio Department of Commerce Director Sherry Maxfield, who is here with me today, as well as the Ohio Department of Public Safety Director Andy Wilson, who is also with me, as well as Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. I met also with their respective teams. And our purpose was to talk about the language that was in the initiated statute, and to hear the concerns that they might have, concerns about the difficulties in its implementation and the risk it poses to Ohio families and Ohio children. We immediately began discussions with Senate leaders and with House leaders about ways to meet our obligation to the people of the state of Ohio. Yesterday, in this room, we had a very lengthy meeting with Senate and House leaders and staff to discuss issues in great detail. The bill before the General Assembly, while respecting the will of the voters, the bill that was just passed out in the Senate committee, while respecting the will of the voters, deals with the practical challenges of implementing its program and protects as best we can our children, our families, and those who don't want to be exposed to marijuana at all. It's very important, I believe, that this bill that is now in front of the Senate pass and become law. And it's important that this occur as soon as possible. Let me talk about where we will be tomorrow without the enactment of this piece of legislation. Without the enactment of this bill, we will have the following situation. While it will be legal for Ohio citizens to possess marijuana, there will be no place for them to legally buy it. This bill deals with this, and it deals with it by speeding up the time frame when adults will be able to purchase recreational marijuana legally, thus reducing the opportunity for the black market to flourish. And as I've talked to the director, one of her big concerns is the fact that this black market will just take off. People will be getting it from many sources, none of them legally. The consumption will go up. People will be able to use it, but they won't be able to legally buy it anywhere. We do not need an expanding black market. Without this bill, people could be buying marijuana that has fentanyl in it. The leading cause of death in the state of Ohio of overdoses is fentanyl, 80% of our deaths. It could be marijuana with pesticides in it, metals in it, other toxic contaminants that we know are often found in black market marijuana. Next, without the passage, without the passage of this bill, our children may be exposed to marijuana smoke in any public place. For example, while waiting in line to see the Nutcracker at Playhouse Square in Cleveland next week. Another example might be while enjoying any of the numerous Christmas public light displays throughout the state of Ohio. And each of us, I'm sure, can supply our own example. Further, without this bill, we're going to see more and more signs and billboards for illegal marijuana, including ads targeting our youth. This bill will speed up the process for enacting advertising regulations, and so that we can get control of these advertisements for illegal marijuana. This bill provides important protections to help prevent all of these very bad consequences. This bill will also create a permanent source of funding for the following: suicide prevention programs, the 988 programs, substance use treatment and prevention, poison control centers, safe driving initiatives, law enforcement training, jail construction, drug task forces, marijuana record expungement, and marijuana control operations. All of these are in need of funding, and all of these under this bill will be permanently funded. I urge both houses to pass this bill right away and to send it to me for my signature. We're talking a moment ago about what we're beginning to see in Ohio, and we started seeing these the day after the election. People trying to sell marijuana. I'm brazen enough to put up signs like this. This was found in Ohio. We don't intend to advertise for these people, but this is what is happening, and people are already assuming that they can buy marijuana legally. We will be doing in Ohio what we do in regard to liquor. It is a controlled operation. It's a controlled state. And so people cannot today buy it, but they can have it tomorrow morning. In a few hours at midnight, they'll be able to have it, they'll be able to consume it, but they won't be able to legally buy it. That is a recipe for disaster. And it's very important for the House, for the Senate to get this passed and for us to be able to move on. So happy to answer any questions.
Governor, what is your understanding of where things stand with the House? We know the bill's going to pass the Senate today with bipartisan support. What have you done to get House support?
Yeah, I have had long conversations with the leadership, with those who are working on the bill. They know exactly, I think, what the concerns are. The director had the opportunity, both directors yesterday, as I said, to explain in detail exactly what the problems are connected with the language of the bill and what we're kind of a mess we're going to be in tomorrow morning. So, you know, some of this is complicated, and but it was important to bring the director in, and she gave them, I think, a very, very good briefing. They had questions. You have to ask them if they had any concerns about that, but I think there's a real understanding after that meeting about why we have to move, and that there has to be a sense of urgency. So I believe the Senate is going to pass this, maybe passing it shortly. I would urge the House to pass this. Look, we listened to concerns expressed by members of the House. This is not a bill that has everything in it that I want. It has some things in it I might not want. But are part of our democratic process with two houses and a governor, and is that we try to work things out. And so while this is a Senate bill, we did listen to what the House said, and you know, tried to come up with something that we believe that they can support.
What's your understanding, Governor, what's your understanding on the tax rate in the Senate bill? The original version had it at 15%.
Yeah.
Is it
Yeah,
still at that level? Or
yeah, this is going to generate, I think, Sherry, what do we say, about 280? 280. When it's up for a whole year and moving, it's going to generate about $280 million. And so you'd have to ask them, you have to look at the exact, but I was looking at the kind of the bottom line, what that tax was, and then frankly, you know, what the best way to spend it. And we.
Well, there was some concern that would price people out. I mean, a higher tax rate
Sure.
would make it more expensive and push people to the black market.
Yeah, we don't think that's true at all. We think it puts us in a reasonable spot, and that's certainly, you know, we all agreed that we had to find a sweet spot. We wanted to be able to tax it, and look, this is it takes some money to even police this and to run this. So, you know, we wanted sufficient money to do that, and frankly, do some other things that we thought were in the public interest. On the other hand, we don't want it to be so high that it does, in fact, shove people, you know, to the black market. And so we think we've hit the sweet spot. There's no, I don't know if there's any exact science to it, but we think that we've hit the right spot.
Governor, do you feel that it's a sweet spot, particularly with the THC extract limits set at 50%, which are substantially lower than neighboring states that do have, I don't want to say that state up north, we've heard that a lot this week. Michigan's is set around 90 or higher, and this is about 40% lower. Is that a sweet spot, or would that potentially drive people out of state
We don't think so. I don't know, Director, if you have any comment about that.
So not all states regulate THC content, some just regulate dosage. The fact of the matter is, even if it's a lower THC, you could take more than one dose, so it evens out in the wash, if you will.
And why don't you also talk a little bit while you're up here about something you and I have talked a lot about, and that is the size of the gummies and that concern. 'Cause
Yes.
To me, it's rather complicated.
Yes, so the initiated statute was silent on dosage. Most states are at a 10 milligram, 100 per package. The initiated statute was 90% THC and no limitation on dosage, which I think raises a whole host of questions and concerns.
Look, just to follow up on that, we want to make sure people know what they're taking. We want them to have some idea of what impact that's going to have on them. And so someone who, takes a big gummy, may have some results that they don't want and we don't want. So we want to make sure people know what they're doing as much as possible.
Governor, last Senate bill, Homegrown goes down from 12 to 6. Does that ignore the will of the voters?
No, I don't think so. I think this, I'm going to ask the director to come back. Look, I would prefer no homegrown, but once again, you don't get everything you want in the bill, and this is a question of compromise. But what I want the director to do, though, is to tell how much marijuana this actually is. Because I think it's important in the discussion.
All right, so home grow is supposed to be for personal use. You're not supposed to be able to sell it or even give it away. A mature plant, home grow, will produce roughly between 75 and 100 joints. I want you to multiply that times the 12 that was available under the statute per household, and then remember that growing periods don't take a whole year, so there's multiple growing cycles. Most more sophisticated growers can get 3 cycles a year, so you do the math.
It's a lot. And so what's in this bill is still much exceeds what a person would be able to consume themselves. And so, again, the idea, I think what people were voting on, they wanted to be able to grow it themselves for their own consumption. They can clearly do that under this bill. In fact, they're going to have a lot more than they can consume themselves.
Are there any glaring examples in this bill that you do not agree with?
I think part of, trying to work out a compromise is not to stand up here and talk about the things you don't like. So, but look, I think it's a good bill. I think it's a good bill. Part of this is a compromise. Going back, I didn't vote for the bill. I was not in favor. I did not vote in favor of this ballot initiative. But the people voted for it. And as I said the day after the election, we have an obligation to follow the will of the people, unless that's changed at some point. But we also have an obligation to make this work and to try to protect people who, don't want to be exposed to marijuana smoke, but also the people who are consuming marijuana, to make sure that it's pure, that is, in fact, it is safe. And so all of these changes, a whole bunch of the changes, I think, bode well for those objectives. The objectives we have, I think, we're meeting with this bill. I think it's a very, very good bill, and it's imperative that this thing get passed. What we don't want is a situation where the black market grows, and we don't want a situation really where people don't know what the rules are. And we just need to get this done and help get it out for the people of the state of Ohio to understand exactly what's in it, and we'll move ahead with the implementation as the people ask us to do.
Governor, are you planning on asking the House to reconvene tonight? They've adjourned until 9 a.m.
No, look, I think, I'm not going to tell the speaker how to conduct the House. I think the important thing is that this gets passed. And, if it's tomorrow, and that's okay, but what we don't want is just to go on day after day. We don't want a situation where, this just doesn't get passed. This needs to get passed.
So does this need an emergency clause? Because even if it did pass tonight as written, it would still take 90 days for it to go into effect.
That's right, but again, it's a real signal. And when you talk about, the people who are in the black market, yeah, they can operate for 90 days, but, if you're in the black market, you may not decide to invest a whole lot if you've only got 90 days of action ahead of you. So, again, would I like it to be in effect right now? Yes, I would. That's not where we are, but I think that, it will send the right signals and tell everybody what the rules are. I don't know if you want to add anything else.
No, I
Got it?
don't think that
Okay.
covers.
Who else?
Quick question for Ann.
Allowing dispensaries to sell this is a big change. Is the industry ready, and why was that the right choice?
So actually, shortly after it passed, I had several members of the industry come to me and say, could I do this as a pilot program? And I reminded him, we're ruled by laws, and I couldn't just do that on my own. I think they will be ready, and obviously, if anybody isn't ready right away to sell rec, we're not going to make them, as long as they continue to keep their doors open for medical purposes. That would be fine too.
A question for
Did you look at
Andy.
other states, how their best practices and how they handle this?
So we are in contact with all the states that regulate marijuana, both on the medical side and the rec side. To the governor's point about the delay, I'm going to use New York as an example, and for those of you who follow this issue, it's pretty well known. It took a long time to get the program up and running. In Manhattan alone, they had over 1,000 pop-up, i.e. illegal stores. And so this is a race to try and close the door.
Question for Andy. It's illegal to cross state lines right now with marijuana, and it's still going to be under this law. It's also illegal for you to buy on the black market. How is public safety going to handle, are you going to target people that are crossing the border? If there is, or is it a illegal sale, do you arrest the dealer but not the buyer?
So look, our frontline law enforcement officers and deputies deal with this every day. So with respect to the black market and sales on the black market, it's going to be business as usual, going after traffickers, going after people who are illegally putting these drugs out on the street. The calculus just changes a little bit because people are allowed to possess the amounts in the enabling language right now. So
What about crossing state borders?
So yeah, I mean, obviously we do that anyways. We pick off people who are bringing drugs illegally across state borders all the time. So we will continue to do what we're doing.
So in this 90-day window, would you prefer people go to Michigan to get marijuana or buy it on the black market?
None of the above.
Well, I don't know if that's going to be.
Neither. What else? Anybody else? Okay, everybody good? All right, have a good evening,
Thank you.
everybody. Thank you very much.